Right. Well, here we are. I am Shelley Eisen. I'm the digital news editor for the Christian Chronicle. I'm here with Talibah Metcalf. Talibah, tell us about yourself.
Okay, hello again. I'm Talibah Metcalf. I work at Drexel University. I'm a scientist in the Division of Infectious Diseases and HIV Medicine. And I basically just been working with infectious diseases for over the last 10 years. And I'm here just to talk about COVID-19 and to give some information and help people out.
Yeah. Well, let's just dive right in here. So we
Okay.
were talking about this COVID-19 and just there's a lot of information out there. It really can be overwhelming. So if you were to tell people some useful, good information for where we are right now, early August 2020. What do you think is really important for people to know about this virus and kind of where we are here in the United States?
Okay, so again, there's a lot of information and then it changes every day. So I can understand someone who's not in a science background could just be overwhelmed with all this information and you don't know which direction you should go in. So I'm just going to keep it simple. We have a novel virus and scientists are studying and we're working on it now. And like I said, every day we get a new batch of information that may support what we already know, or it might disprove what we know, or might add to it. So it's okay when you see scientists say something in March, and then they're saying something different in June, and then it's August, and it sounds like they're saying something different again. That's just the process of doing research. Like every experiment is going to bring more information. So as a scientist, I'm okay with the story changing because I'm used to it. But as someone who's not a scientist, you can be like what do I believe? So just to keep it simple, it's a novel virus. We're working on it now. There's tons of vaccine studies in the work trying to get a vaccine so we can get back to our normal life. And we all have a role to play. And it's basically wash your hands, social distance, wear your mask when you can't social distance, when you're at the store, at the movie theater, or the gym, or whatever, wear your mask. And to disinfect your house, just to be clean, disinfect your house. Make sure that stores are disinfecting the stores, that jobs are disinfecting the elevators and the bathrooms. And just to do all these different parts while we wait for a vaccine to come on the market.
And
And it's very simple. Just be clean, wear your mask, social distance, wash your hands.
I think you're right. And when you say it like that, it does seem simple. I think for some people, since this is something that we've never dealt with before, we've never been asked to wear masks. We've never had to shut our businesses or stay home or social distance. We've never had to do anything to this extent. So it seems like, that I always kind of say change is hard, but do you think that, I don't know, I guess kind of what would you say to people who are like, well, we've never had to do this before. Why is this so different?
Uh, I mean, yes, we never had to do this before. Uh, but at the same time, is it really, uh, initially we didn't really know a lot about this virus. So we're beginning to know more. So that's why the restrictions are beginning to be a little bit better because we're starting to know more. And so I guess I just don't have a problem with some of the change. I understand the shutdown initially because we had to do that because we didn't really know what we was dealing with at the time. But if people just work together and just care for one another, we can kind of go back to a normal life almost. We can go to work, potentially, if we get the cases numbers down, we can pretty much have a normal life. Like we
Yeah,
don't have to do this whole shutdown. We're only doing the shutdown because the cases are so high. So
right.
we just do simple things, then we can kind of go back to the life that we sort of had last year.
Yeah,
So
yeah.
yeah, then change is something that we have to do as living on this earth and being a human being. There's always something, like we didn't have a cell phone before and you had to get used to a cell phone. Like the technology is changing. We can adapt to technology, so we should be able to adapt to situations in science and medicine. So I think, I know we shouldn't just see it as just this big burden. I mean, initially it was, but if we work together, it will be less of a burden and easier for all of us to like live our lives and move on. And
So
then I also don't think that this is going to be the last virus. It might be another virus. So once we get all of this implemented now, the next coronavirus, we will know what to do and we'll be able to adapt to it easily and move on. So I guess it's just my mindset. Like you have to you have to be able to adapt because situations change every day. You can't stay in this one setting the whole time.
okay. So let's see, for yourself, since you work in infectious disease and researching, and what's this kind of been like for you to have something that's so new, and then just for yourself to be looking into it and researching yourself, and just kind of what's this been like for the last few months for you with the work that you do?
So initially, so Drexel like shut everything down, told everybody to go home. So, and then, so because of our lab, we just can't shut the lab down, turn the lights off, lock the doors, and then not come back for a couple of months. Because we have to, we have equipment. There's still a couple of experiments that was in the process of being run. So they made a list of essential workers. So, so technically I've still been in the lab, just coming in, checking on equipment, making sure deliveries are being delivered and stuff like that. So just recently we have started to come back into the lab. We can pick up our experiments. So, and then my lab is collaborating with other labs throughout the US where we are collecting samples from coronavirus patients that are admitted to the hospital. So we're collecting based on the nasal swabs, the blood, so we can just study the immune response. So the biggest question is, why did some people are asymptomatic? Why did some people have mild symptoms? And why did some people have severe symptoms? So we can study the immune system from these three different subpopulations, then we can kind of understand why, like what's happening inside the body, and then that can lead to treatment as well as vaccines. So that's what my lab has started to set up now. So that's what we're in the process now. It's basically processing corona-19 samples every week. So
That's super interesting. I think just to be able to say like you're part of just any group that's researching it in hopes of finding out more about whether it's a medication or a vaccine, or maybe explain to us a little bit for those of us who don't know. We've heard normal vaccine trials take years. They're kind of trying to speed something up here, or even knowing which medications may work the best. All of that kind of takes a little trial, and so maybe just kind of explain a little bit about how that generally works, and maybe how it's working a little different in light of this pandemic, or is
okay.
it?
Yeah, so for clinical trials, I mean, I can't really speak too much on it because I don't do clinical trials, but it definitely is different stages. It's the first stage is just to see how, let's just say it's a vaccine. So the first, like the results that we're seeing so far is basically you give different doses to different groups, and then you just basically see how they respond to the vaccine. Like they look for symptoms like headaches, was it sore in that spot? Was you able to like move your arm the next day? Was you nauseous? Just symptoms like that. Because we want to find a dose that doesn't give people too many side effects, and then but also produce a good immune response. So the next stage is to see what this immune response is. So we found the dose that seemed to not to have too many side effects. Now we can see what is the immune response? Is it T cells? Is it B cells? How long did the antibodies stick around? And then you also have to have different populations of people. You need young people, you need old people, you need people with underlying conditions, because all of us, our immune response is different, and we're going to respond to the vaccine differently. So like older people, it's like the flu vaccine. Older people, immune response is not as strong, so they don't respond to the flu vaccine as strong as someone like who are in their 20s or 30s or 40s. So we have to test the different population to see, okay, we have a vaccine, but what is the actual overall response in the whole population, like a general population of the US or the world? So that can take, years, like that can take a while for us to get to these different stages. It does seem to be moving very quickly. I don't really have an opinion on that. I mean, I understand we can't be in shutdown for the next 3 years while we work on a vaccine. So that could be the reason why things are moving quickly. Um, Hopefully we can get something that works. Um, yeah, I mean,
Yeah.
I don't want
No,
to
that's
say
great.
too much,
Yeah, no, I
but
appreciate, yeah.
yeah, but
And like
while
you
we
said, things
wait for
are
the
changing
vaccine,
and the research is progressing and I do
yeah,
think that I like that you talked about that earlier. I think that's been a hard thing for some people is how like in early March when we were first really here learning about this, some things were said and now some very different things are said. And so I think that's hard for some people to grasp, like, why is it so different? But I appreciate that you addressed that just because science is something that, and as the research on this continues, like it could change even more, which is why I mentioned at the beginning, this is early August 2020, like even a couple of weeks or a month from now, things could be really different.
yeah, yeah.
Um,
So you have to pay attention to the things that are being consistent, like washing your hands, social distance. Um, and then I don't really know why they said in March not to wear a mask, but then they changed that to wear a mask. I think that's what started a lot of misunderstanding about the mask. Because from what I understood, they said that so everyone wouldn't go out to buy a mask. So there'd be a mask for the medical workers and our essential workers. But I don't know, I guess it should have been worded differently in March, not to say, oh, don't wear a mask, it's not going to help you. And then you come by 2 months later and be like, everybody wear a mask. So I can see people being like, what? So yeah, that was, to me, that seemed like that was a mistake to me.
uh-huh.
So
Okay.
uh,
Now, are you
yeah,
somebody that, like your local church, are they like kind of looking to you for advice on this, or kind of what's your conversations as far as the church community? What are those looking like?
yeah. So they have not reached out to me, but so everything for my church is virtual. So it's basically Zoom. So we're not meeting inside the building. We're not meeting outside. And I don't know. I think that might be the case for at least to the end of this year. So I think if they decide to move outside, meet in the building, then they might have they'll reach out and be like, what do you think that we should do?
Mhm.
But I mean, the church population is it has a lot of older people, and then sometimes it can have a lot of people with underlying conditions. So that's a population you have to be very careful with. So even if you're inside the building, sometimes you sit close together. And then church is hands-on, it's hugging, it's kissing, it's so
Mhm.
that's a
I think you're
population that
right. Like church is hands-on. It's the hugging and the kissing or the shaking hands. And I've seen some people say, well, why can I get on an airplane or why can I go here? But why are they recommending I not go to church? And
yeah,
maybe that's part of it. Like you're saying, because it's a more loving,
yeah,
personal, like interpersonal, you just have those closer relationships. Whereas if you're
yeah,
at this, you're not really connecting with those people in the same way, maybe. I'm not sure.
yeah. I mean, that's like my favorite part of church. I mean, I hug more during church service than I do, at work or,
Mhm.
so yeah, that's like, I'll be hugging
Yeah.
the elders, you're shaking hands at least. So it's like, yeah, it's going to be hard, especially for people that's been in the church for their whole life. And
Mhm.
now you're like, oh no, don't hug. It's going to be like, what? Don't hug.
Yeah. Yeah. Right. Well, I mean, obviously I know you can't say any of this for sure, but are you hopeful that that um that we can see changes on this within I don't know, I mean, obviously these things take time and research, but from what you're seeing, does it seem like good progress is being made as far as the research that's being done on this virus, and just any hope that we will someday return to some sense of normal.
Yeah, yeah, I do feel, yeah, yeah. I mean, wonderful research is being done. I mean, one thing that has really Corona has helped is the collaboration between different labs within the university, outside, like different universities are collaborating with like regional or like, you know, in my group, it's like, you know, Emory, universities in Case Western, uh, Harvard, you know, in California. So, and then, you know, and there's so like we're sharing data. It's like no one is like working on coronavirus secretly, independently, and then, you know, oh look what I found. It's like it's more of a collaboration going on, which is what science needed to be, you know, we just so used to like being independent and trying to like, you know, be the first to like publish or going to get a grant. So, I mean, that's the one thing I like about Corona is really bringing scientists together. There's a lot of Zoom meetings and sharing data. Like, look what I have. I just did this. What do you think? So I really do feel because of that, we will have a vaccine soon. And I mean, yeah, it's not going to be years. It might even be this year. So it's definitely, that's why I'm telling people just to hold on. It's not going to be forever. Just do the simple things that every one of us can do. And then before you know it, we have a vaccine. And then it's like, oh, okay, we can move on. And then if we have another coronavirus in 2 years or 3 years from now, we will all know what to do. We won't have to go through this if we get like another coronavirus. We'll be like, oh yeah, we know what to do. So
Yeah, we hope
yeah,
so, right? Yeah. Well, that's
yeah,
the
we hope. Yeah, we hope.
So, was
Yeah.
there, I feel like we really addressed a lot of things. Is there anything that we're missing or that I haven't asked you about that you really feel like is an important thing to address for people to know about?
No, I think we covered everything. I think, um, yeah, I think it's just basically to get the case numbers down, to get just to have a sense of control. I think that will help people move on to the next stage if we had a sense of control. Because right now it doesn't really seem like we have that. It seems like every state is doing something differently. I mean, almost like every city in a state is kind of doing something differently. So if we just have more of a uniform response from which within the state and then all the states together, and then we would all had like a simple plan that we can follow, I think that would put people at ease. I think that's what's missing in the
Yeah.
US right now. It's just the sense of, okay, this is what we do. This is going to move us to the next stage and then the next stage. So
Yeah.
I think if we all just do our part with the social distance, and I know it's hard and it's summertime and people wants to go to the beach and hang out and have a good time. And I'm not saying you can't do that. You just probably can't do that in a huge group of people without wearing your mask or yeah. So I know it's rough. I understand, but
Yeah.
yeah, we have to think about the bigger picture. We have to, you know, care for one another and just even people you don't know, you have to care and love these people, you know? And we
Yeah.
all have to make sure we get to the end together, at least, you know, as many as possible. So, so